Okay, so we have covered cleaning out your nose every night, especially if you're someone who suffers from allergies or congestion. You're going to use a nasal wash for that. We've covered propping your nose open with mute. I didn't mention then, but you can also use the Breathe Right strips. I don't like those as much because they can either fall off if you have any kind of lotion or oil on your face. They can fall off. And then the other type that are really sticky, eventually, if you are using it every night, can start hurting your skin, start peeling your skin off. So I use mute. I like that the best. The next thing we're going to talk about is mouth taping. Usually when I bring this up, my patients are like, what are you talking about? That seems crazy. So I like a product called NextCare Micropore. It is just a gentle paper tape made by 3M. You can get this at the drugstore. Mouth taping is great to ensure that you're not mouth breathing during the night. So your tongue propped up against the roof of your mouth, hopefully. We will talk about that on another video about myofunctional therapy. But you tape your mouth closed because then you have to breathe through your nose, right? You've done the nasal wash. You've propped it open with mute. You're going to cut a piece of tape. This is like 2 inches long. You're going to bend the, fold the little edges down so that you have a nice, easy way to get the tape off of your mouth. This doesn't seem all that sticky, but it will warm up against your skin and become even more sticky. So I touch it once to my clothing. And I tell people, and this is how I would do it for myself, to have a vertical, this is a little bit too big, have a vertical tape. So you can, talk. You don't feel like you're going to suffocate. And it comes off easy. So that's going to keep your lips together and have you breathe through your nose. If this seems crazy to you and induces panic, put it on your mouth while you're washing the dishes or making dinner or reading a book before bed. Try wearing it for 5 minutes around the house. Increase the time the next day to 10, increase it to 15. Get comfortable walking around with your mouth closed, breathing through your nose. If you can do it 15, 20 minutes during the day, like in the evening before bed, you can do it at night. And you are not going to suffocate because you're going to pull this off if there's any issues. You'll wake up and it's not on your mouth anymore. So I usually tell people I would like them to do all 3 of these things, the nasal wash, the mute, and the mouth taping for 2 weeks. And maybe keep a journal, but evaluate how you feel every morning. Like, how is your sleep overall compared to how it was before you tried any of these things? 9 times out of 10, people feel better. So this is the first step in correcting issues with sleep disordered breathing. I wish you all the best. I hope you've enjoyed my videos.